Welcome to this explainer. Today, we're going to fundamentally shift how we think about human biology, weight, and health. If you've ever felt totally frustrated by that incredibly simplistic advice to just eat less and move more, well, you are absolutely in the right place. We're going to dismantle those outdated stigmas right now and dive into the concrete, evidence-based mechanics of the human body. Let's get into it. Okay, let's just kick things off by calling out the single most pervasive, damaging myth out there: the idea that obesity is simply a lack of willpower. This idea incorrectly blames a person's character for what is actually a deeply biological issue. Honestly, blaming a lack of willpower for obesity is literally like blaming someone for their height. It's ridiculous, and it completely ignores the massive, complex biological machinery running behind the scenes. When we look at the actual clinical definition recognized by major global health organizations, the reality is stark. Obesity is a chronic, complex, relapsing disease involving abnormal or excessive adipose tissue accumulation that impairs health. I really want you to notice those words, chronic and relapsing. What this brilliantly illustrates is that we're dealing with a highly complex medical condition that requires a long-term management, not just some quick fix or a sudden burst of motivation.
Section 1. The biology of weight, a complex web of factors.
So the crucial takeaway here is that body weight is highly multifactorial. Sure, genetic susceptibility lays the foundation, and, our modern environment of processed foods plays a massive role. But it goes so much deeper than that. Did you know that poor sleep and chronic stress directly alter your metabolic rate? Even certain everyday medications, like specific antidepressants, can fundamentally shift your energy balance. It's an incredibly intricate web we're looking at. Now, this is fascinating. When it comes to fat, where it's located actually matters far more than just how much of it there is. You have subcutaneous fat, which sits just beneath the skin. But then you have visceral fat. That's the fat stored deep within the abdominal cavity, literally wrapping tightly around your internal organs. Modern medicine points to this visceral fat as the primary driver of serious metabolic dysfunction. For the longest time, we kind of just thought of fat as passive storage, right? Like a biological backpack of dead weight. Actually, scratch that. We need a massive paradigm shift here. Adipose tissue is actually a buzzing, active chemical factory. It is a living endocrine organ. It actively secretes hormones and inflammatory cytokines that are constantly communicating with your brain and the rest of your body. And this buzzing factory feeds right into an intricate hormonal loop that regulates your appetite, where your hypothalamus acts as your body's energy thermostat. First up, your stomach releases a hormone called Ghrelin, which basically screams to your brain, "Hey, I'm hungry." Then, after you eat, hormones like GLP-1 and leptin signal fullness, telling your brain to stop. But here's the kicker. In obesity, this communication pathway often becomes resistant. The brain simply doesn't receive that "I'm full" signal, regardless of how much willpower someone might have. Section 2. The body-wide toll, systemic impact of chronic inflammation. Here is exactly how this systemic toll unfolds at the cellular level. When fat cells become excessively enlarged, they get stressed out. To clean up the mess, immune cells called macrophages infiltrate the tissue, but in doing so, they release these inflammatory cytokines. This creates a state of chronic, low-grade inflammation that directly blocks normal insulin signaling, which literally sets the stage for type 2 diabetes. And because adipose tissue is hormonally active, this systemic inflammation impacts almost every major system in the human body simultaneously. Beyond the metabolic issues like diabetes and liver disease, just look at the mechanical and respiratory impacts. Increased joint loading leads to severe osteoarthritis, while airway narrowing creates obstructive sleep apnea, which, by the way, fragments your sleep and actively makes those metabolic issues even worse. It's a full system challenge. Section 3. Measuring health beyond BMI, a comprehensive clinical assessment. Because of this body-wide impact we just talked about, it becomes pretty clear that simply stepping on a standard bathroom scale doesn't give us the full picture. BMI is useful as a very basic population screening tool, sure, but it has massive limitations for individuals because it can't distinguish between fat and muscle. A true comprehensive clinical evaluation goes deeper, measuring visceral adiposity through waist-to-height ratios, assessing your cardiovascular status, and evaluating your actual muscle strength and mobility. Section 4. Modern evidence-based treatments, the new era of management. Thankfully, as our scientific understanding has evolved, so has our clinical toolkit. We've moved way past the outdated advice of simple dieting. Today's international standard of care actually relies on 5 pillars: sustainable nutrition focused on protein and fiber, exercise that integrates resistance training,
behavioral therapy for sleep and stress management, and, crucially, powerful medical interventions like GLP-1 medications and metabolic surgeries.
Now, with all the recent media hype surrounding these new treatments, you might be wondering, is a GLP-1 medication or bariatric surgery just a magic bullet? Well, the definitive scientific answer is no, absolutely not. They are incredibly powerful tools, for sure, but for them to be truly effective, they require strict medical supervision and a long-term commitment to those foundational lifestyle changes in nutrition and exercise we just mentioned. You see, modern treatment is actually a carefully tailored spectrum. Let's look at a real-world clinical scenario. Say we have a 52-year-old with severe knee osteoarthritis and prediabetes. For them, simply exercising is incredibly painful. So pharmacotherapy might be introduced first to target their appetite pathways and ease the weight burden on their joints. Once that happens, it finally allows them to engage in physical therapy. It's all about combining the right tools to fit the patient's specific biological reality.
Section 5. A new paradigm for health, looking toward the future.
As we wrap up this explainer, we really need to look at where the medical community is heading next. The fight against this chronic disease is advancing at an absolutely unprecedented pace. The future of obesity care is deeply, deeply personalized. We're moving toward precision medicine, using advanced genetic research and microbiome analysis to tailor interventions to your unique biology. Imagine AI-assisted management and wearable tech providing real-time metabolic feedback, paired with therapies that perfectly mimic your body's natural satiety signals. I want to leave you with this final, perspective-altering thought today. We have literally spent decades obsessing over gravitational pull, what the bathroom scale says. But true success in managing obesity isn't about reaching some arbitrary number. It's about achieving a vibrant, metabolically healthy, and highly functional life. So I leave you with this. How much healthier could our society become if we finally stopped judging bodies based on a number and started supporting the complex biology within them?